The cause of uterine fibroids isn't well understood, and there are risk factors that we all need to be aware of. And the Lakeland Vascular Institute's Dr. Larry Whitney joins us to share more information on this topic and perhaps more importantly, how you can help. How you doing today, Doc?
Great. Thank you very much for having me, Natalie. I appreciate it.
You are welcome. Again, I mean, I've heard the term, but I really don't even know a lot about what fibroids are. So kind of take it away for us. Okay.
Well, and a lot of women don't, and obviously this is a major women's health issue. So it affects about 4 out of 10 women. In the African-American population, it actually is about 5 out of 10. So it's a very common issue. These are benign, non-cancerous growths within the wall of the muscular layer of the uterus. And so they can be the size of a pea, they can grow to the size of a cantaloupe, so they can vary in number, size, location, and they can produce different types of symptoms. And every year there are about 200,000 hysterectomies performed for uterine fibroids. So they're 3/4 of the time that fibroids are treated, they're actually treated surgically. So my goal today is to try to educate the public and say there's actually a less invasive way to go about treating these.
Interesting. Well, if people are watching at home, what are some of the risk factors or people need to know that, hey, I need to kind of think about this?
Sure. So a few things. One, as I mentioned, the African-American population, women tend to be about 3 times as affected. They can actually have about a 7 times greater risk of having symptoms to the point where they actually require some kind of treatment like surgery. So that's one big thing is race. Another thing is actually obesity or being overweight can actually predispose you to having fibroid growth as well. And there's a couple other hormonal imbalances and things, but those are kind of the biggies. As far as what to look for, because a lot of times these are asymptomatic, about 10 to 20% of the time they're actually symptomatic enough where you're going to require treatment. And so those are the patients that we're really trying to go after and see if we can help them. And so basically what we're going to be looking for, and I tend to break them down to 2 categories of symptoms. You've got the bleeding, which is heavy bleeding, might even result in anemia to the point where you're just having prolonged bleeding during your menstrual period, where you're just saturating pad after pad, and you actually lose so much blood that you might require transfusions. You might feel tired, run down, lightheaded, dizzy from being anemic. Or you have what I call the bulk symptoms. Those are symptoms resulting from the size of the fibroids. As I mentioned, they could be the size of a cantaloupe. So you put a couple of fibroids that size in there, you obviously can get, almost look like you're pregnant, essentially. You can have that much abdominal distension. It can impress on the rectum, cause constipation. It can actually impinge on the bladder and cause you to have to pee frequently and have to pee at night. So there's all kinds of different types of symptoms to look for, exactly, and just sometimes just chronic pelvic pain.
Well, we definitely want to finish off though today by talking about how you have the less invasive way to treat these.
Right. So the uterine fibroid embolization procedure, also called uterine artery embolization, is when we go in either through the artery in the wrist or the artery in the groin, the femoral artery. We introduce a little catheter, which is just a long, skinny tube, which we can steer in the body, and we first select the artery that goes to the left side of the uterus, and we inject little particles in there that are the size of sand grains, and then we'll go back and we'll do the same thing on the right side or the other side, and we inject it until we basically shut down all the blood supply to the fibroids into the uterus. And so that causes them to shrink. At about 6 months, you can expect the fibroids to shrink about 50 or 60%. So you'll see some pretty significant decrease, and the bleeding symptoms will almost stop instantaneously. So.
Well, it sounds like if you get a diagnosis with this, give you guys a call because you have a much better way to handle it, less invasive way.
Yeah, and it's a quick recovery. Typically 7 to 10 days, you're back to work. You might feel like you have some low-grade flu-type symptoms, and some cramping pain, but typically it's an outpatient procedure.
Okay, good stuff. Well, I want to point out your website and information if people are interested.
Is you can look at the Lakeland Vascular Institute.
Okay.
And look us up.
I was going to say, there you got it right on your screen.